Hey everyone, welcome back to the channel. So today what we're going to talk about is we're going to go through a series of hip flexor stretches and exercises that will hopefully give you some immediate improvements in the flexibility of your hip flexors. And then the second half of the video, what we're going to get to is a really important concept where we're going to talk about, I guess you could call it the hidden cause of hip flexor tightness. And one of the things that I see a lot clinically is there's a lot of work that goes into stretching hip flexors because we know they get tight, or if not tight, they become restricted in some capacity. So we want to try and sort of restore normal function to those tissues as much as possible. But we seem to miss the bigger picture a lot, where we're not also having a conversation about rectifying why those hip flexors have become tight in the first place. So again, hopefully we'll go through 2, maybe 3 really simple exercises to mobilize those hip flexors. And at the end, we'll touch on another exercise and another conceptual piece that hopefully ties it all in together so that you can have confidence that if you're putting the work into improving the quality of your hip flexor function, if you're doing these 1 or 2 things, you can have confidence that they're not going to keep getting tight again. You're going to keep making progress away from where you are currently. So if you're someone who has chronically tight hip flexors, if you have a hip that clicks or cracks or flicks at the front, these exercises are specifically for you guys. So before we get into it, let me know in the comments below. Let me know, what are you dealing with? Like, are you just having some tight hip flexors? Does it flick? Does it crack? Does it click? Is your hip flexor, I guess, a consequence of another issue, or is that hip flexor causing other issues? Again, clinically, we know that if your hip flexors are tight, there's a stronger risk of low back dysfunction, and we'll get to that towards the end. We'll tie that in together. But also, it can sort of increase your risk of obviously hip dysfunction, but knee dysfunction as well. So hopefully this video will be useful for all of those categories. And by improving the health and function of those hip flexors, hopefully you can restore function to a whole range of other areas that you may not have realized were connected. So let's get to it. So the first 2 exercises that we want to go through are giving you the capacity to immediately improve the function and the mobility of your hip flexors. So I'm fully aware that, looking around YouTube, just talking to people in general, there's a million different ways that you can supposedly improve the flexibility of your hip flexors. Not all of them work really well. And even the ones that do work, they may not work as well as the things that I'm about to show you. So I think it'll be really useful for you guys to take note of how tight your hip flexors may feel at the moment. Then do each of these exercises, then quickly recheck your hip mobility afterwards, and you should expect to see a change. You shouldn't have to wait. These aren't exercises that you have to do, for 15 minutes a day for the rest of your life in order to see some incremental change. If you're not seeing an immediate difference straight away, then you haven't made any change. Nothing's changed, and that's not good enough. So we want to set a high expectation with these exercises that you're walking away after this immediately feeling like there's benefit there. And then obviously the more you do that, the greater that benefit will be. So I think the first exercise is one that we go through a lot on this channel. Again, popularized by Kelly Starrett of Mobility WOD / the Ready State. It's just the couch stretch. And it's a really important stretch because it can improve the quality of your quads, the flexibility of your quads, but it's a huge exercise to improve the function of your hip flexors. So essentially what it is, and it's called the couch stretch because, excuse me, ideally you'd be doing it on the couch, but again, like we do in all these videos, we'll do it down on the floor. I'll use the corner of this wardrobe here, or the cupboard, but again, please feel free to have your knee on the seat of a couch or the seat of a chair with your shin back up against the seat. Again, in this case, we're going to do it up against the wall. But again, without going into too much detail to start with, we want your knee back into the corner of whatever you've got. And just remember that being on the floor is a lot harder. Using the seat is much easier. So knee in the corner, shin vertical. We're going to bring the other leg up, and we're going to try and get yourself eventually up as high as you feel comfortable. And depending on the person, you might find that you can only get halfway before you feel a real tightness at the front of your hip. You may even feel it down through the front of your thigh. The beautiful thing about this stretch is you have options. So if you're feeling it more through the front of your thigh and you're really looking for where your hip bone is at the front, sort of in from that, you can push your hips down and forward at the same time to really bias that part of the capsule or the soft tissue at the front of the hip. And again, if you need to, you can extend through your hip further, again, pushing it down, and you can shift your hips from side to side in order to make that more specific to what you guys feel you need. Now, again, with any of these stretches, You can use what's called a power band, and we'll get this out in a second. But in this position, one of the reasons that this stretch or this type of stretching defines better progress than a lot of other stretches is we want you to get active. So wherever this feels tight, what I want you to do is to squeeze that tightness as hard as you can for 5 to 10 seconds. And what you'll feel is the muscles that you're stretching should automatically feel like they're tensing up. And what this does is gets your brain involved. It's that PNF stretching, that proprioceptive neuromuscular facilitation. It engages those muscles so that when they relax, you have that peak relaxation at the same time. So again, a good tense, squeeze your butt cheeks, squeeze the hip flexors at the front, hold that for a few seconds, then relax. You should feel you can go a little bit further into that stretch. Now, so that tends to address a lot of the muscular tightness through the front of the leg, the front of the hip. But by using a power band, a stretchy band, and I'll leave a link in the description just so you can see what these are and look to get one for yourselves if you feel like you need to. But we can get the same response here, an even better response, by hooking the band around our hip and then doing the same thing. So coming back into the corner again. It's the same position. So again, if you're on a chair, the band would be higher, and we want to come upstairs again. So as we extend backwards, the band hooking around underneath that gluteal fold, pulling forwards, is opening up the front of the hip and biasing the joint capsule. So without the band, this tends to be more of a muscular stretch, so the hip flexors. With the band, it's hip flexors and hip joint capsule at the front. Again, the capsule gets really stiff for some reasons we'll get into in a second. And adding a band or some elastic tension involved can really help open that up a lot further. And you can see some really fantastic benefits in terms of your hip mobility by using a band and doing the couch stretch. So again, we want to make sure that hip joint, those hip muscles feel looser than they did straight away. Otherwise, you've just wasted your time. It's not good enough to do a stretch if you don't see an immediate benefit. So that's exercise number one. Second exercise involves a ball. So you can use a foam roller if you want to. It's a little bit awkward for the front of the hip, but we'll come back to this in a second for the second part of the video. Tennis ball, lacrosse ball, which this is, baseball, cricket ball, depending on where in the world you're from. And we want to get that ball and place it into that hip flexor area. So if you're looking to find the hip flexor itself, if you can locate the bony bump at the front of your hip, the traditional hip bone, and just come straight in from that, if you're pressing in that area, you'll find some of the hip flexor tissue. We want to place the ball in that area. We want to lie down on the ball. So we want to get the ball into that area just inside of the hip, and we want to move the ball around until we feel like we hit something that feels a little bit tender, a little bit tight. Shouldn't be too hard to find. And what we want to do here is we've got a few options. We can just let the ball gently press in, take a few deep breaths, some relaxing breaths to allow that tissue to give. Or you can include some movement. So for me, by straightening my leg, I'm getting some hip extension through the hip. And if I've got some pressure on the ball, what I'm doing here is I'm compressing that tissue, and then by extending my hip, I'm pulling that tissue past the ball and giving it some sort of like a shearing effect to help free it up. Again, you can bend the knee. You can do the same thing by lifting your knee off the ground. Or what you can do is you can just rotate your hip from side to side again to get some shearing. Again, another option is you can actually get in there and try and grind that tissue away. Anything that feels tender and tight is fair game. You want to make sure that you can clear up some of that soft tissue restriction. It's a very safe exercise to do, but obviously respect that tissue. Don't go any harder than you feel comfortable. But same thing again, the same rule applies. It should feel immediately looser and freer afterwards. So by doing the couch stretch with or without a band, you get to the muscular soft tissue, you can get to the joint capsule, you can get to any of the other fascia, any other soft tissue restrictions at the front of the hip, really unglue that tightness. Now, again, as we go through with all these videos, those exercises in isolation are just symptomatic treatments. They're there to try and take a hip flexor or a hip flexor area that's become restricted and tight and less mobile, and taking it to a point where it's more mobile and it can express itself more normally. But if we're not having that sophisticated conversation about why that hip flexor area has become tight in the first place, then you're going to have to keep doing those stretches in order just to maintain the same state that you're in. And it's very hard to make that super quick progress to become someone who used to have a hip flexor issue if we're not addressing the potential cause of these problems. So, and with any hip flexor dysfunction, whether it's pain, weakness, tightness, flicking, cracking, whatever it might be, there's two main conversations that we need to have surrounding its cause. And in order to understand these conversations, we just need to backtrack a second and just talk about what the hip flexor is. Now, most of us know that the hip flexor is, without going into too much details of what the muscles are called and things like that, because at the end of the day, it doesn't matter. But there's a group of muscles or some muscular tissue that anchors into the front of the thigh. That makes sense. It needs to in order to bend that hip and flex that hip. But the other aspect of the hip flexor that we often forget, or we don't sort of focus on enough, is the hip flexor, part of it attaches to the pelvic bowl or the pelvic rim, the pelvis itself, sorry. But then another part of it actually anchors into the front of the lower back, the front of that spine, the front of that lumbar spine. So it has a really strong connection to your lower back. And if your lower back is stiff, then your body and your brain can recruit that hip flexor to provide extra stability to help support that low back dysfunction. So it's really important to understand here, and this is the first part of, I guess, the second half of the video, is if you're not paying attention to the health and function of your lower back, then your hip flexors may stay tight, or they may keep being asked to tighten back up again, regardless of all the soft tissue work that you're doing. And this is where the foam roller can become really useful. So if you have really tight hip flexors or hip flexor dysfunction, you can take a foam roller to your lower back and find the segments of your lower back that are stiff, free those segments up, and then you should see an improvement or an upregulation of your hip flexor function. And how that looks for most people is, we're not necessarily just looking at the base of the spine. A lot of the hip flexor attaches to sort of the top of the lumbar spine, potentially some of the base of the thoracic spine. But the key point is, it doesn't matter sort of what the textbook says. We want you to go finding and hunting around for some stiffness in this sort of mid to low back, and take away that stiffness and then see what happens to that hip flexor. Because if you hit a spot that feels really stiff and then you retest your hip flexor mobility and you see an improvement, then obviously you know that that's connected. You don't have to guess, you don't need anyone to tell you, you don't have to trust anyone, you know for sure. So, and then we can sort of start to paint this picture of why that hip flexor is tight in the first place. So again, we're not necessarily going down low here, we're going at the base of that rib cage area. And again, what we want to do here, similar to the lacrosse ball, or part of the lacrosse ball exercise, is we don't want to roll up and down, because we're trying to address segmental spinal stiffness. And what we want to do here is we want to move the roller around until we hit something that feels a little bit stiff, maybe tender. It doesn't have to be tender. But for me, this section here feels a fraction stiff, a fraction tight. And so I just want to stay here. So obviously you can come at it from the other end, where you rest your head on the ground, lift your bottom up, and then just tension that down to a level that feels comfortable for you. We just want to get you to stay here for a little bit. Just spend some time letting the roller press in and affecting change in those joints. And then once you've found that spot and you've had enough on that spot, it might take a minute, 2 minutes, whatever you feel comfortable with. We then want to move the roller up a fraction or down a fraction to find the next section that feels stiff for you. And again, when you're in that position, what we want to get you to do is just move across from one side or to the other to see which side of your spine is stiffest. Spend more time on the side that feels the stiffest for obvious reasons. So it's really, really important. If you can release a lot of that sort of hidden, covert low back stiffness, the muscles as they attach to that from the front, again, have less reason to be tight and can be cued into freeing up as well. And you can hopefully see this in real time by testing your hip flexors, doing that exercise, and then retesting them again. You should feel like there's a difference if you hit the right spot. So that's the first part. Now, the second part is, apart from understanding that the back's involved in hip flexor tightness a lot of the time, the second most important thing, and it's often the most boring, and we've talked about this a lot because we have to, but the other issue that needs to be addressed if you have hip flexor tightness surrounds your sitting habits and your sitting posture. Now, the amount of sitting that we do is quite a lot these days. And the reason why sitting is so important is when we do sit, we're often sitting in this 90-degree hip position. And our hip joint should have the ability to express itself in a large range of motion consistently. When we're stuck in this 90-degree position of the computer, this hip becomes stiff because we're not expressing that sort of full range of motion. So if the hip flexor becomes tight and we can't extend the hip very well, Sitting is one of the main culprits because it's always stuck at 90 degrees and we're not lengthening that tissue as much as we could. So over time, if that's a position that we have deemed valuable, then our brain also deems that position valuable. So it sort of robs some function from that area because we're not using it. And the second part of this is what we often find with a lot of people who sit is when you use the foam roller and figure out where you are stiff through your back, it's actually very likely that when you do sit down, whether it's on the couch, at the computer chair, in the car, at the desk, wherever it might be, you might find that that is the section of your back that you might be hinging through or relaxing through if you relax or slouch. Now, it's an important conversation because, again, if you're working really hard to free this back up, you're working really hard to stretch and getting all this treatment on your hip flexor to stop that dysfunction, if you're then just dumping back into the same position all the time, you're potentially giving your body, robbing your body of permission to get better. So it's going to consistently keep you in that cycle of having to do the symptomatic treatment after symptomatic treatment, paying for therapy, doing exercises, all these things, when without realizing it, you might be getting sort of perpetuating the need for that to be there by unknowingly getting into some less than ideal shapes. So it's really, really important to touch on those ideas because again, the couch stretch and the ball through the front of the hip are really important and really impactful, effective exercises to do for the hip flexor. But if we're not having a conversation about your spinal function and your spinal positioning and the amount of time that you're sitting, then we're missing something along the way. So again, hit me up in the comments below. Let me know how you're going with the hip flexor issues. Let me know what you think of those ideas. Clinically, when we're talking about these things with my patients, we can sort of test this in real time to sort of show them that this part of their body is connected to this part and that it's really important in terms of freeing up the back, improving your posture so those hip flexors feel better. Obviously, through YouTube, it's a little bit harder to do that, but you guys can figure that sort of stuff out by testing, doing the exercises and then retesting again and seeing that change in real time. So let me know how you find that in the comments below. Also, if you went on to enjoy this video and you found it useful, if we hopefully sort of exposed you to some information that you maybe didn't realize before, please consider leaving a like below and consider subscribing to the channel if you are new. It really helps us out. It helps these videos reach more people, which is the point of them, I guess. We just want to help. We want these pieces of information that we talk about with people every day to reach more people because they're really basic. Everyone deserves to know this sort of stuff. And there's a lot of people suffering with a whole range of different problems that potentially don't have to. There's a lot of simple solutions to a lot of complex problems, but we're not necessarily getting fed the right information, or maybe not in that sense, but there's information that's getting missed or not getting sent out as much as it could be. So if you could do that, that'd be fantastic. As always, let me know what you'd like us to cover. I'm always happy to take requests. I've got a whole bunch of stuff coming up that I'm keen to put out. But I always want to make these videos as specific to your issues as possible, just so they're useful. So with that being said, thanks for joining us, and I'll see you in the next one.